So good morning everyone. I am Dr. Piush Pandey, postgraduate trainee, Department of Community Medicine at IQ City Medical College and Hospital. Today I am here to present my paper titled Medicine Adherence Among Geriatric People with Type 2 Diabetes Mellitus residing in Durgapur, West Bengal, a cross-sectional study. So these are the contents of my paper. So India is experiencing a significant demographic shift driven by advancements in healthcare, which is projecting the rise of geriatric population to 319 million by 2050. India has become the diabetic capital of the world. Thus, with the increasing number of diabetic patients, effective glycemic control mandates adherence to medication so that microvascular and macrovascular complications which are increasing can be controlled. Poor medication adherence in India varies from 28% to 72%, and its assessment, especially among elderly, is very important as they are the dependent population. So aims are to find the level of medicine adherence among geriatric people, geriatric persons with type 2 diabetes mellitus residing in the field practice area of our USTC, and to elicit the factors that are affecting the medicine adherence among the study participants. We did a observational cross-sectional study in the study setting of Urban Health Training Center of our college. Geriatric patients who were known cases of type 2 diabetes and on OHs and residents of the study area for at least 1 year were selected. Those having functional disability, those who refused participation, and those who were critically ill or on hormone or steroid therapy were excluded from the study. It was conducted over 4 months in 2025 from January to April. The sample size, minimum sample size calculated was 123, and systematic random sampling was done with OPD register as the sampling frame. We used a pre-designed, pre-tested schedule which included medicine adherence report scale 5, that is Mars 5, which takes into account habits like forgetting to take medicines, altering the dose, stopping medication for a while, deciding to miss a dose, and taking less than instructed medications. The scores range from 5 to 25, and good adherence is classified with a score of more than equal to 20, and poor adherence is taken if the score is less than 20. So we found the proportion of good medicine adherence as 57.8% among our study participants, but 42.2% having poor medicine adherence was a cause of concern. Medicine adherence had a relation with pension status as well. We found poorer medicine adherence among those who did not have any pension. Source of money to buy medicines was also found as a factor. Those who depended on government supply for having medicines that is free of cost had better adherence than who were dependent on their family members for money. We did a univariate and multivariate logistic regression to find out the predictors, and the predictors were advanced geriatric age, that is more than 70 years, source of medicine, that is own money or bought by family members, and no pension status were the critical predictors for controlling medicine adherence among our study participants. Fitness of the model was good as per Hosmer, Lemshaw, and Cox and Snell and Nagarkarke. Coming to discussion, in our study, as we discussed, medicine adherence was 57.8%, which comes somewhere in between the medicine literature of review that we did. In a study done by Udapa et al., they found 72% good adherence, while a study done by Mishra et al., the adherence was poor, 44% was the medicine adherence. In conclusion, our present study revealed 42.2% of geriatric diabetics exhibited poor medicine adherence, advanced age, male gender, non-pension status, and out-of-pocket expenditure were critical predictors. Thank you.
So very well done study. So, and it carries an important message as well. So in your criteria, you kept patients who were on steroids or hormone replacement therapy out of your study. So what was the logic behind that?
So those who were on steroids or those who were on hormonal therapies, they could have adherence. They could have a better adherence because usually they are the patients who are more sick compared to normal population, sir. And also, sir, they will be on regular hospital visits and usually not coming to our USTC, sir. So we excluded them straight away, sir. And also, sir, they will have a false rising of sugar levels also, sir.
So sugar level was not an outcome of your study. It
No,
was
sir, we were
adherence
taking
only.
diabetics, sir, so
No, I understand, but the sugar level could be high, low, whatever. You were only looking at the medication uptake,
Yes, sir.
medication intake ratio.
Yes, sir. We wanted to focus more on OHs only, sir. And they were not part of it, sir.
And from your study, suppose you have to give a take home to the medical community or to the government, what would it be?
Sir, actually, the government has implemented a lot of programs for benefit of elderly. For example, we have NPHC, NPNCD, we have free clinics that are being run by government. Free medicine is being provided. The thing is, there is lack of knowledge and awareness among the geriatric population. Even as private hospitals, we run a lot of camps trying to reach more patients, giving free medicines. Still, sir, this adherence is not to that level. Maybe there is due to
So in your
trust
study,
issue.
those who were without a pension and say were poorly adherent and going to a private setup. So did you try to look at whether they knew that it was available in the government setup free of cost?
Sir, yes, sir. Though there were patients who were getting medicine free of cost as well, but there were a lot of people who did not know. So, sir, further we are also planning a explanatory kind of mixed method
So the
study.
reason why they are not going to the government, whether they do not know about it or
Yes,
not,
yes, sir.
that
For
you are
that, sir,
trying
we-
to do something.
Sorry, sir. For that, sir, we are planning an explanatory study as a mixed method because we will be trying to know more about them by interviews or other methods. More so, sir.
No, you can go ahead. I'm just giving you the next question.
More so, sir. Yes, sir.
So have you taken in the question how many of them they actually know about the disease, what is diabetes and diabetes complications?
Sir, diabetes complications as
To
such.
say that,
I mean,
that they're one of the reasons of not taking the medicine
they don't know probably
beyond the
diabetes.
economic status would be that they don't know that if I don't take it, it might harm me. They are not
Yes,
aware
sir.
about the disease.
So there are a lot of problems that we found.
So
That is,
in your explanatory mixed methods,
Yes,
are you
sir.
trying to look into that as well? Like
sir, everything.
lack of awareness about a government facility and lack of awareness about the complications of
About the
Yes,
disease,
sir.
about
Yes,
the
sir. Lack
complications.
of awareness about disease complications, where they can get free treatment. So there is also lack of trust when it comes to government supply of medicines as well.
No, how many patients of them they know actually about their disease, the complications?
Sir,
Have you looked into it or
Have you looked into it?
we will, sir. We will look into it.
Okay.
That is our plan because a mixed method study will get us, like, we can get into the population and know more about their thoughts because there is a lot of lack of trust, lack of knowledge and everything running in the community that we found. So most of them did not know about complications when we were taking the East-West schedule. So most of them did not know very clearly what are microvascular or microvascular
So
complications.
what do you think? What may be the solution of this?
Sir, most important solution will be the responsibility of us doctors as well as response from the patients as well, because effective treatment is never a one-sided effort from my thinking. So from our side, we will be, as doctors, our function is not just curative but educative as well. So we have to educate the patients that if you are having this medicine, this will be better. If
Just
you are not
another
having,
question is that suppose you are taking geriatric population,
Yes,
so
sir.
you need to know how many of the family members they are living with, because sometimes we have seen probably he or she is the only person he is living in his home.
Yes, sir.
So they don't have like the
whether they have a
opportunity.
family support.
Yes, a
Family support is important.
Yes, sir. So what happened? Family support is very important for this, which will be tackled when we go for a mixed method. Because right now we had a short sample size. Later on, sir,
Okay,
we will
okay. Thank you.
go ahead
Thank
with
you.
it, sir.
Thank you.
Thank you, sir.